which is also of great importance to the people of Ghana. We want to zoom in into the health sector and look at how infrastructure is changing the paradigm when it comes to the health sector. And to help us with the discussion this morning, I've been joined by Dr. Ruth Bernice Adigbo. She is with the Family Medicine Department at the Greater Accra Regional Hospital. And Mohammed Mustafa Seni, he is the Laboratory Manager at the Greater Accra Regional Hospital. So, lady and gentlemen, welcome.
Thank you.
Okay. Bernice, let me start from you. There's been so much talk about the role infrastructure, technology plays in the health sector. If we take the Greater Accra Regional Hospital as a point or a case study, how important do you think, infrastructure and equipment and technology plays in the whole health delivery sector in Ghana?
Okay, thank you, John. So, you definitely cannot underplay that. If you don't have the infrastructure, you cannot deliver. If you don't have the human resource, you also cannot deliver. So we've most of the time found ourselves in a situation where, okay, so we don't have the equipment. So you have to outsource a lot of things. You have to go outside the country to get things done. Or when you have the equipment, you probably don't have the personnel to man the equipment. And then that balance is never really achieved. But I suppose what we're here to talk about this morning is the fact that for the first time, you can actually have a hospital here in Ghana that seeks to address the situation, and you can find out, from our discussion later on, that which hospital has come to kind of fill the gap or to build that balance that we've wanted to have in a long time.
I see. Let me bring you in, Mohammed. Mohammed, sometimes people think that once you have the equipment, you have the infrastructure, the story ends there. But it's also important for every world-class hospital, the services you provide is essential. Can you bring us up to speed to some of the very essential services that, for example, as a result of the infrastructure development and equipment and technology that's been invested into this particular project, people of Ghana or patients anywhere in Ghana who come to that hospital, for example, can enjoy those services?
Yes, thank you, my brother. Yes. At the new place, we have 5 units in the lab. And currently, hematology, we have only 1 analyzer. Chemistry, we have only 1 analyzer. So once it's break down, you are out of business. You can't do anything. But at the new lab, all the units has backup analyzers. Chemistry, we have 2 backup analyzers. Hematology, we have fully 5-part hematology analyzers. Microbiology, for the first time, I've been working in the lab for over 10 years. For the first time, we have a fully automated blood culture system. What that means is that today, if you come to this hospital to do blood culture, you get the results in 7 days. But with the fully automated blood culture system, you get the results within 2 days.
I see.
In blood bank, we still take samples to Kolebu to screen. And we buy FFPs, cash and carry from Kolebu, because we don't have the capacity to produce them. But in the new facility, blood bank is able to screen our own sample. Even in Kolebu, the system they use, they're able to screen 90 samples within a day, because you are using semi-automated system. But at our place, we have full automated system where you can screen 200 samples within 1 hour. So your screening depends on the number of whole blood you have. And we will be able to produce all the blood components. We will not need to go to Kolebu to buy FFPs.
Mustafa, so let's break it down for people to understand. For the ordinary person on the streets, the things you mentioned, he really doesn't bother about it. But what does this translate into the life of a patient that walks into the
Rich hospital? Like I mentioned with the blood culture system. Blood culture, about 90% of the people who do that are children. It's the children's ward that bring most of the cases. You bring a child and you need to get the results before you'll be able to determine what to do. You bring it, I will tell you, you come to get the results 7 days time. Within 7 days, a lot can happen. So now if you're able to get the results within 2 days, I think that is too much for us.
Exactly.
Yes.
So at least for a patient.
And with the children's ward, they need, most of the time, they need fresh blood. Fresh blood. What that means is you come to donate blood, within 1 day, the blood is ready to be used. In a system where you take the samples to Kolebu to screen them, it takes a week or 2 weeks. But now, you're able to screen the blood as and when the blood is ready. So you get fresh blood to save lives.
I see. That's important for us, because then we know that the more time you have, the better it is for you as a patient. The survival rate is always calculated that way. Okay, good. Doc, let me bring you into the conversation. people are concerned about the kinds of services they receive when they visit hospitals like that.
Yeah.
So beyond what you have in technology and infrastructure, customer service remains an important part.
Yeah.
I have been to a hospital where virtually the nurse just shouted at me because I was not feeling well and I was unable to articulate well. When it comes to customer service delivery, what stands out about this new facility?
All right, John. Important. We'll talk about customer service, but just before we get to that point,
right.
First of all, what are we even offering in the first place? What's different? So, Mustafa has just spoken about what we can do by virtue of, laboratory services.
Yeah.
But as a hospital itself, people have been used to going to sit down as part of customer service experience in queues for hours and hours on end before they can see a doctor, and even that you're not guaranteed seeing a doctor. So we intend to run a system where people who need to just come in and go out can't book an appointment, and that's the corporate wing of a hospital, which is something new that is coming up. So you don't necessarily have to just come and then your fate is determined by the elements that's going on around. You can book an appointment either online at our website, which will be up and running very soon, or you can call to book an appointment. So if you have corporate institutions that don't want to take away from the productivity of their staff, you can actually register with Bridge Hospital, and then we know that Mr. A is coming to see us today at 2 p.m. So you can actually expect that person to come back to the hospital because they have a 2 p.m. appointment. By 3 o'clock, they're done and they're back. And we see your wards as well. Now, if there are individuals who also do not want to go to other institutions and then their fate is left open, they can also book with us. And we take the private insurance that you have on the market, all of those other ones. And you can have a very good customer experience. So you can imagine all this is working towards making sure that you just don't spend the whole day in the hospital.
Okay.
And as part of what we've also done to ensure customer experience, there's been a training that's been done for the frontline staff, nurses, doctors, lab technicians, people who will be in contact with patients on how to speak properly, how to receive your patients, how to triage. And what we just spoke about is the corporate side. But then there's also the emergency medicine department.
Okay.
So if there are emergencies that come in, people will just not sit down and be wondering, where are you from and all that. They know where to flag you, put a red tag on you, and we know that you have to be attended to immediately, and then you can get benefits from that. Okay. Yeah.
All right. Let me bring you in. When you talk about the human resource to manage some of these things, do you have the human resource to manage all these things? Because it appears the technology is out of this class, out of this world. So in terms of getting people to manage, from doctors to technicians to whatever you may call it, do you have that resources to
We have the resources. But before I come there, I want to say something about the customer service. If you go to Rich Hospital as we speak, entering my lab is very difficult because we don't have waiting area. Fresh people coming to do lab and people coming for report, they are all standing. The place is choked. They always complain. Most of your place is too much. Your customer service is too bad. But at the new Rich, we have a very big waiting area. We even have a 40-inch LED TV.
Which should always be on TV3.
Wow, which will always be on TV3. So people are relaxed, seated, and we'll call you as and when you are ready to come in. And one thing, there is only people who are coming to do lab that come there. If you're a fresh person coming to do laboratory tests, you don't come there for a report. Now we have a software where once the lab is run, it's with a doctor. The patient just need to come to lab with a code. We enter the code, we see all that the doctor requested that you do. We do the lab, you don't come back to the lab. You go to the doctor, he or she enters the code, and everything about the lab is there for you. I think that is customer friendly.
It's important.
Yes. Talking about human resource, at which I don't think there's any lab in the world that has more than the technical know-how of my people. The standard in Ghana, the highest person in Ghana is the chief biomedical scientist. We have chief biomedical scientists at Rich. Okay. We have 2 deputy chief biomedical scientists at Rich. We have 5 principal biomedical scientists at Rich. We even have 2 PhD holders in the lab.
I see.
So there's nothing that is lab that we cannot do.
I see.
John, to add to what he said, on the medical side, it's also very, very well staffed. Okay, so from the subspecialties, internal medicine, we have an endocrinologist who takes care of stuff with endocrine. I don't know how to say endocrine. So diabetes, hypertension, people who have tumors that have to do with secretory stuff. Okay. And then we have cardiologists, people who deal with the heart. We have a nephrologist, kidney doctor. Okay, we have neurosurgeons. We have, you name it. Every department is well represented in Ridge Hospital. And that's just to make sure that you don't have to keep going to one place or another. It's a referral center. So once you get there, you should be able to, assess any kind of service that you need. And the good thing is, if you are not even in Ridge Hospital, but then you are in another facility, and then you want to come to Ridge Hospital to, say, have an operation, and you want that particular doctor who is not in Ridge Hospital. Once you come to the hospital, your doctor can apply, and then we will make sure that the credentials of a doctor is such that it qualifies him or her to do the procedure. And then we rent the facility out to the doctor. So it's like having kind of an agreement with the doctor and the patient. So you pay us, and then you take part of what you also have to take.
And
so
use the facility and use all the equipment and all that.
Yes, exactly.
I see.
Yes,
I see.
so that is also
very interesting. Maybe in wrapping up, let me come to you. It's about maintenance. At the end of the day, there's so much talk about how plush the place is. Some call it 5 stars, 6 stars, 18 stars. But at the end of the day, 5 years from now, 10 years from now, will we still be able to say that this has, it took a lot of time to invest into it, but will it stand the test of time?
To stand the test of time, because we at Ridge Hospital, we have a very competent management system, one of the best in the hospitals I've worked in. Like she mentioned, every department and unit is well structured, that you have to take care of your unit or your department. The management is so good that we are capable of even improving on what we are seeing today. So I bet you 5 years, come and see. You tell me, are we now commissioning this hospital?
I see. We pray also. Final words to you, Doc. The way we've painted the picture, somebody from a village far away from Accra will be scared to walk into the hospital. Okay. But for people who may have need to use the facility, what word do you say to them?
So please don't be scared. Ridge Hospital is still a Ghanaian hospital for all Ghanaians. This is just an add-on to what is already being done. I mean, previously, anybody could walk into Ridge Hospital with a referral or even without a referral and be seen, and that is not going to change. This is just to say that for people who just need to kind of come in and out so quickly, I mean, they can also be taken care of, okay? And most of the time, people would want to come to a public hospital, but they think they can't have that service, so they'd rather go to a private facility. And you may not have all the expertise. This is just us telling you that you can have expertise and you can have that customer experience that you also want. And really, taking care of Ridge Hospital, much as it's the responsibility of the administration and the staff, it's also the responsibility of the patients that come in. Because you would have people, spitting where they shouldn't, littering where they shouldn't, and all that. When you come in with the mindset that we all need to work towards preserving this, it's something that belongs to all Ghanaians.
Right.
So work on it, and we work together with you. We want to maintain this, not even 5 years to come, 15 years to come.
Yes.
Still remain like that.
Okay, yes. All right. On that good note, let me say a big thank you to you, Dr. Ruth Bernice-Adigbo, who is with the Family Medicine Department at Greater Accra Regional Hospital, and to the laboratory manager, Mohammed Mustafa Seni, who's also with the hospital. Thank you for coming.
Thank you.
All right.